So technically speaking, mental illness is the disruption of a person's feelings, thoughts, and emotions. And this disruption interferes with one's ability to cope with the stress of life. Pretty general definition. And often it's caused by a biochemical change in the brain, an imbalance of tiny little protein particles. I know the nursing students would know this for sure. Tiny little protein particles called neurotransmitters, and the imbalance of neurotransmitters that takes place in the brain. Truthfully, I don't really like the term mental illness. I understand it has its applications at times, but I don't like saying that someone is mentally ill or saying that someone has a mental illness. Because if mental illness is the disruption of a person's feelings, thoughts, and emotions, we all have moments in our lives where our thoughts, feelings, thoughts, and emotions are disrupted. That's pretty normal. And if that's the case, if we all have these moments, then you could kind of say that based on that definition, everyone's a little bit mentally ill at times. We all deal with some kind of mental illness in the way it's defined. And this aspect of illness is actually a pretty common aspect of human experience. Something unexpected happens to us. We meet challenges that are stressful. We face tragedy. We grieve loss. I had a 20-year-old friend who just passed away a couple months ago, an unexpected death. And sometimes that loss is unexpected, or it's out of our control, or it's beyond human understanding. Sometimes we just deal with the daily wear and tear of life. Regardless, these are all things that at some point we have to face. And these are things that disrupt the way we ideally like to feel. So I don't like saying and talking about people coping with mental illness. I like to say that people cope with mental health, because I feel like a term like mental health is something we all have, and it's something we can all relate to without worrying about this concept or feeling of illness. I think that a lot of times by using the term mental illness, it actually hinders or, makes people shy to come to terms and deal with their problems because they worry about being labeled as ill. And that can have a very significant ramifications on being able to help someone treat themselves or provide them the appropriate treatment.